While other states in India are showing signs of improvement in their battle against COVID-19, Kerala's case is worrying. Even as some of the states in India witnessed no death in last 24 hours and a decrease in number of COVID cases, Kerala has seen a constant surge. The state has reported nearly 1 million cases of coronavirus so far and 4,000 people have succumbed to the disease. As per reports, Kerala has nearly 45% of the total active cases in the country today. But when other states were battling it out in the beginning, Kerala was already doing well to curb the COVID fatalities and contain the virus. There were days when the states did not report even a single case in 2020. So what exactly went wrong with Kerala? As per reports, and many people believe that Kerala became a victim of its own success because people started to behave as if the situation was normal as the cases went down. But right from the last week of December is when COVID cases began to rise again. Although India's first 3 COVID cases were reported in the Kerala, it took Kerala nearly 110 days to report its first 1,000 cases of COVID-19. By the second week of May 2020, the situation was under control and people started to applaud the Health Minister of the state, K.K. Shailaja, for maintaining and curbing fatalities and for containing the spread of the virus. Now, when Keralites saw the rest of the country not wearing the masks, as in during Bihar elections, or not practicing social distancing during rallies, they started to relax. They thought that all was fine after all. But the cases began to rise again when Kerala residents stranded in different states due to the lockdown began to return home after the second week of May. 2/3 of the 9,700 cases reported in Kerala from mid-May to mid-July were of incoming travelers. So these travelers were in fact the carriers. Secondly, while most big states reported a peak during mid-September, Kerala's peak for COVID came in October. In fact, Kerala's COVID peak came a month after every large state. Kerala's early success, which meant that fewer people had developed immunity to the virus. And this backfired. Since Kerala initially controlled the epidemic very well, it had a large pool of vulnerable people. Now, as per a survey, the prevalence of antibodies was found in Keralites was minimal. This means only relatively few people in the state had the disease and had acquired some level of immunity against it. Large number of people were still vulnerable. Then came the festive season in August, December and January, during which there was no lockdown, no restriction in the state, and also reduced number of tests and contact tracing methods to track the patient. That was also dropped. Today, Kerala accounts for nearly 1 in 2 active cases in India. And finally, Kerala is most urbanized state in India, third most densely populated state as per census of 2011 with a population of more 65-year-plus people. It has a higher population of overweight and obese adults as per National Family Health Survey of 2019-2020. It's also a state with highest proportion of adults with high blood pressure and sugar levels. All these are risk factors for severe COVID-19 illnesses. So it does turn out that a premature celebration is what led to the state becoming victim of its own success.